Now we're going to demonstrate the MSR 4-point knee mobilization procedure. Starting out, we're going to focus on a posterior glide of the tibia in relation to the femur. And we're going to use traction in most of these movements. So what we're going to do starting out is create a posterior movement as I'm tractioning on the distal tibia and fibula. I'm gently squeezing the bones between my knees here as I sit back and extend my knees a bit to create that traction. Good. So we're going to come back again. We're going to do this again. And you can really feel it opening up as you maintain that traction. So maintain that throughout the entire movement. Doing okay?
Okay.
So you'd want to do that about 2 to 3 times, depending on the restrictions that you've identified and are treating. There we go. Good. Now, what we're going to do here is change our contacts. We're going to go on the tibial tuberosity, nice flat thumbs. Once again, we're going to initiate the movement by tractioning down on the tibia and fibula. And then at the end range, we're going to go internal, external. So we're tractioning, and then we're going to start to create internal rotation. Hold those end ranges for a few seconds, and slowly come back, maintain traction, and go external. Doing okay?
Oh yeah.
Yeah. Make sure to check in with the patient so that everything's comfortable. Going back again, maintaining traction, back to internal rotation. And one last time, we'll go back to external rotation. Good. Now, for the third part of the protocol here, we're going to address the fibula. So one thing to think about is when the patient dorsiflexes their foot, the fibula will move slightly superior and the proximal end moves posterior. When the patient plantar flexes, fibula moves inferior and the proximal end comes slightly anterior. So we're going to start with plantar flexion. So you're going to find the fibular head, slightly medial to it. Don't use too much pressure because it can be quite sensitive. Okay, so now you're going to plantar flex. I'm tractioning inferior and then I'm pulling anterior as well. Good. And come back. Let's do this again. So tractioning inferior and encouraging anterior movement of the proximal fibula. Good. Now we're going to reverse our direction. So you're starting slightly plantar flexed. I want you to come up and dorsiflex. So this time we're going superior and posterior. Okay, so there we go. And we're encouraging posterior movement. Good. And back. Once again, nice flat broad contact, not too hard. We're going superior and posterior. Good. And now lastly, we're going to affect the knee capsule by performing some posterior and anterior glide. So this is similar to an anterior posterior drawer test. So nice flat broad contact posteriorly. We're going to gently pull the proximal tibia and fibula as well, slightly anterior, holding those end ranges. And then we're going to reverse direction. And with my thenars, I'm gently pushing posteriorly. You can really feel the translation here within the joint. And once again, an anterior glide and reversing posterior glide. Good. And that is the MSR 4-point knee mobilization procedure. Really effective.